morning. It is Friday. We made it, August 6th. Welcome to the Morning Medical Update. Dr. Stites, Dr. Hawkinson here to talk all things COVID, Delta variant, masking, you name it. It is Follow-Up Friday. We're going to get to a bunch of questions that we could not get to this week. But let's get straight to the COVID count. Dr. Hawkinson, good morning to you.
Hi.
How are you?
I'm good. It's Friday.
Happy Friday, for sure. Any changes in the numbers?
Yeah, the changes are a little bit better, have gone down. 32 active infections with 10 in the ICU. Unfortunately, 9 are on the ventilator. So a good proportion of our ICU, our critically ill patients, are on the ventilator. We still do have 14 additional patients in that recovery period. So our total is 46. But overall, if we can get the active infections, down as low as possible, I think we are up at 40 at one point this week. So that's good.
I think one of the reasons that our active numbers are down is because we're not taking transfers right now.
Yeah.
And we're at 805 total patients. We have 11 patients in the emergency room with orders without a bed and 3 sitting in alternate care areas, which means there's 14 patients who don't have a real hospital bed right now. And that's part of the struggle here and across Kansas City because everybody's pretty darn full. We staff every single bed. Now we're staffing 14 more beds, and we just opened up 30 beds.
I was just going to say that, yeah.
Or the new unit. And so what it really means is that we aren't getting a lot of transfers of COVID in, and that's partly why our numbers are down. Had we been taking the same number of transfers in with the same length of stay as we did last fall, we'd be pushing the 70, 80, 90 numbers on our COVID counts. So.
And I would like to say that Hays has 8 active infections, so they're kind of hanging in that little bit higher range as well.
Yeah, for sure. All right, I know we have a few reporter questions this morning, so I want to jump in. We have a lot to get to today. Cody, are you on the line?
I am. Good morning.
Hi.
So predictable. Hey, a couple of questions. Dr. Stites, I know that there's a big CMO call later on this morning, so I don't want to steal too much of that thunder. But as we talk about masking, so many school districts yesterday came out and changed their rules. Some went all the way with what the CDC was saying K through 12, you got to wear a mask. Others didn't. Others either kind of kicked the can down the road or went to 6th grade or 8th grade. What do you think needs to be done? What's the best case scenario in your mind at school districts? What should they be doing?
So, Cody, I think this will come as no surprise to anyone. We come at this from a uniquely chief medical officer or infectious disease perspective, and in that world, we're not policymakers, but we know that the absolutely best way to stem the rising tide of COVID-19 from the Delta variant is to be vaccinated and to wear a mask. And so the CDC has very smartly recommended that you have those in place anywhere people are gathered indoors. And I don't think they're differentiating from what grade of school you're in, or whether you're in college, or whether you're at McDonald's, or whether you're at the University of Kansas Health System. I think what they're saying is you should have a mask on indoors, and I think the CDC is right about that. And I think our healthcare systems are really busy, and we are going to talk about that part of the CMO call today to try and get the message out that the Delta variant's here. We're on the precipice of becoming Springfield, and whereas I love the Ozarks, I don't want to have 160 COVID patients here at KU.
And not only that, the American Academy of Pediatrics also recommends that too. So,
exactly.
So people who are dedicated toward protecting children, that's their recommendation as well.
I woke up this morning to that happy email in my inbox saying that my kids will be fully masked and their school district is going to have all kids in masks. So I was like, yes, it finally came through just in the nick of time before school starts.
Yeah. I'd like to take credit, but I think, unfortunately, the Delta variant's taking credit for that. I don't think we haven't really said anything yet, but it comes out today, although maybe people know what we're going to say because I'm sure it's the worst kept secret in town.
All right. Do you have a follow-up question, Cody?
I do, and it's not to do with school, so we'll let you talk about that in an hour. But with the Garth Brooks concert coming up, even Garth Brooks came out yesterday. He didn't quite tell people to wear masks, but said they should feel free to wear masks and that people won't look at them funny if they're at that concert. He told people to keep their distance, but what struck me as odd about that is that when you have 70,000 people shoulder to shoulder, it's a little hard. So what can people do? Obviously, they're still bringing in masks to go through the indoor spaces at Arrowhead before they're going out to the concert.
And I think they need to wear all the masks they can in the indoor spaces. Well, all the masks sounds goofy, but everybody should be masked when they're in indoors. And then I think outdoors is a funny one. The good news is that Arrowhead it is outside, right?
Yeah.
And there are a lot of winds, and your air disperses and will tend to rise from the heat on the field. The predominant thing will be going up, and so I think that hopefully that'll be safe. When I last talked to the Royals or to Jackson County a few weeks ago about are they seeing outbreaks from the Royals games, and they said they hadn't. So if the Royals games or the sporting games are any sign, then hopefully, and I think the number is 58,000 at the Garth Brooks concert. Hopefully 58,000 will be okay. Am I worried? Yeah, but that's my job as a CMO. That's Dana's job as an ID doc. Is we're worriers, right? That's what we do. But we're going to hope that the Royal stats and the sporting stats tell us that it'll be okay. But it'll cause us to pause. And I think if anyone is out at that game or out at that concert who's not vaccinated, and especially if you're not vaccinated and you have underlying health problems, man, I'd keep my mask on indoors or outdoors. Hawk?
Yeah, I mean, I think that's the simple advice and the smartest advice. Again, we do take comfort in the fact that it is outdoors. And that is a big space outdoors. If you're going inside for concessions or the restroom, it's going to be a brief amount of time, but certainly wear your mask in those places.
I'll be there and I'll be wearing a mask, and I'm fully vaccinated. So.
And you're going to be up high too, which is like the safest place.
I told you, my bad nosebleed tickets are turning out to be the best gift.
Ticket in the house. Yeah, you have the hot ticket right now.
I do. But yeah, no, right before they made that announcement at Arrowhead that they're suggesting people wear masks, I text my sister, who I'm going with, and said, I think we need to be wearing masks when we go in, and then let's assess who's around us and how loud they're singing, and how much they're drinking, and how close they are.
And then, actually, that's a really good point, because I think if people are singing around you, you should put your mask back on. And can I just say, when I say hot ticket, I think it's 90 degrees tomorrow. It is a hot ticket.
It is a hot ticket. All across the board. Other questions on the line? Okay, so Noah, Dr. Stites and Hawkinson, you guys have both answered this, but Noah from the Kansas Reflector had a question, if you could just answer it really quick for him. Should hospitals and other medical centers in Kansas be requiring vaccinations to their staff? Is that something KU Health System is considering instituting? And they just want to know a little bit more about that. You mentioned it. Can you go over it again?
Yeah, so, it's not an FDA-approved drug and but it will be FDA-approved, we think, now right around the 1st of September. I mean, with all the leaks coming out of the FDA about their approval timeline, I think that's probably a pretty good timeline. And so I would expect that a lot of places will be saying, hey, we're going to require it then. I think we've been sort of waiting to see that it was FDA approved before we made the move and said to our employees that it's going to be required. And so we're watching the FDA very closely. A lot of places have already said we're going to go ahead and do it. But, interestingly, most of those places have given such a long runway that that runway is going to go right past the FDA decision. So I think that the FDA decision will be just a couple of weeks away. My advice is to go get vaccinated right now. I mean, you and I got vaccinated last January, so I think we felt safe, and I still feel really safe, and I think the vaccines are really safe, so I encourage people to go do it. And I think that healthcare organizations, I think you'll watch that once it's FDA approved. My guess is that those that have not, I think only 2 hospitals in Kansas City have made it mandatory so far, but I suspect that most people are going to move that direction, Hawkeye, once it's fully approved.
And I think in some sense of this, that FDA approval is just a label, because from the public and transparent knowledge and data that we have so far, we have seen that they offer great benefits, very minimal side effects. The safety profile is there, the efficacy profile is there, and so that might just be a label for some people to turn their hesitancy into getting it as well. And so we'd have to be aware of that. Again, that's from all the public data that we know. And certainly the FDA is going to be going through with a fine-tooth comb, looking at further data and analysis and presentation for that.
You know, just to add one thing to that, I think for those people who say the FDA is rushing to judgment, I don't believe that that's true at all. The FDA had to approve over 100,000 pages, I think it was closer to 200,000 or 300,000 pages of documents in order to make sure that the Pfizer drug is safe. And usually what takes 6 to 12 months, they were been able to do in 3 months. But they've done that by reassigning people from other projects onto this. The bandwidth of the FDA is such, they have so many drug approvals they have to go through, that it takes 6 to 12 months to go through. And again, most drugs have about 100,000 pages of information they submit. So this is not new. What's different this time is they put more people on the same amount of information. So this isn't a shortage of information. This isn't a rush job. This is, we put more people on it because we have a public health crisis. And I think that you should feel good about that. The second thing is that when Moderna put their data in, the FDA went back and said, we want more information. So again, not a rush job. They're making it check all the boxes, all the I's are dotted, all the T's are crossed, so don't start saying, oh, they rushed it. No, they didn't rush it. They put more people on it. And honestly, that's to the detriment of other drugs that need to get approved, right? And so please don't start saying that the FDA rushed this, because they have not rushed it. And in fact, Hawkeye, there is more information about this drug, a vaccine, if we can call it a vaccine drug. There's more information about this than virtually any drug we've ever approved, because they've got 1 billion people who have had this diagnosis, or doses that have been given.
Absolutely, and I think as far as the FDA and doing their due diligence and continuing to be vigilant, we saw that with Novavax now, where the FDA has expressed concerns about their production. So they are not cutting corners at all. They want the best thing for the American people and the people worldwide, but we want to get these drugs approved and authorized, but we are still going through the steps to get it. We're just, like you said, putting more people on it, having more bandwidth to do that in an expedited manner.
So none of this matter about the FDA rushing to judgment. They did not rush to judgment. They did dot all their I's and they did cross all their T's.
Thank you for that. Okay, I know we have a lot to get to today, a lot of questions, follow-up questions. You all sent in a bunch of them over the week. We're going to try to sneak in a few if we can at the end of this, because you have your CMO meeting. So let's get after this. Okay, so some parents at school board meetings, you're going to really, hopefully we can put this to bed. Some parents at school board meetings argue kids with masks on 7 hours a day is unsafe due to germs and airflow, often comparing it to doctors who only wear them during a procedure, only during like a 12-hour procedure. What do you think of this argument? Can you really get sick from accumulated germs and your mask all day?
No.
No, there's been no research to bear that out at all. You know, again, it's an argument, it's an opinion, but it's not supported by the facts. Again, we do also have the American Academy of Pediatrics, who we look to because they dedicate their lives, their careers towards doing the best thing for children. They still do recommend it. I mean, I think that's the simplest answer right there. You know, parents don't want their kids to wear masks. That's okay. They have their opinions, but those types of opinions aren't supported by the research at this point in time.
And when we say
can
only,
I just say, well plus the idea that bugs accumulate on your mask and that makes it more dangerous to you is part of the made-up news network. That is a falsehood looking for a home, right? It's giving somebody's just trying. I'm going to make this up so I can justify not wearing a mask, right? I'm going to just make it up because that is just made up. You know, surgeons wear their masks for 12 or 24 hours at a time doing
that was my next question.
Right? It's not just 7 hours, it's not just 6 hours. It's a much longer period of time than that. You know, when we change masks, if we get them wet, or something happens to the integrity of the mask, then you change the mask. That's true. But it's not because you've had it on just necessarily for 7 hours.
Yeah, and we've been wearing masks, and when I say we, I mean that the collective, whether it's adults or children, for, 18 months now or 16 months now.
A long time.
We haven't seen a lot of increase in those types of bacterial infections or anything like that. What we have seen recently, though, and our pediatrics colleagues will tell us, since masking has been lessened or the restrictions have been lessened, there have been a lot more RSV cases and other types of viral illness that are spreading through those normal methods of spread that we had before COVID.
All right, I asked that question just because we're a week out, so a lot of parents want to know. Okay, so how soon do you think that we'll see a positive change in COVID numbers due to the new KCMO mask mandate?
Well, I think it all depends on whether or not other communities follow suit. You can't just do it by yourself. I do think the Kansas City, Missouri mask mandate will make a difference, and I think I'm gonna cross my fingers. You go to the grocery store now and you see a few more people. Actually, some of the grocery stores, everybody's masked. I've been to places where everybody's got masks on again. I'm like, this is great. So I think we'll start seeing it in a week. I mean, the last time we put a mask mandate in place, the curve started to bend really fast, and I think that could easily happen here. Now, it takes really it takes about 7 to 14 days to get sick enough to be in the hospital.
Yeah.
So the hospitalization curve will take a little bit longer. But I'm hoping the new diagnosis numbers, right? When we see that curve, the Kansas City Star, where the number's been shooting up lately, I am very hopeful that could start being bent right away.
Yeah. Yeah, I mean, I think we hope it's as soon as possible. You have to understand, just like you said, it's the cases, but also then it takes that time to get to hospitalizations. And what we have been saying recently is that hospitalizations are going to be the real bellwether of what is the spread in that community. For one reason or another, people may not want to go get tested. They don't have access to testing, but we know that the disease is out there in the community. So, hopefully it will be soon. And, when are we going to see the peak overall in cases and hospitalizations? I would certainly hope it's before, some of the colder weather sets in, whether it's 4 to 6 weeks or 6 to 8 weeks. But that, we still have to kind of keep our eyes on that.
And I would just say, BKC. We have bent this curve before. BKC.
That's right.
Bend it again. Come on.
Love
Bend it like KC. Bend
Love
it like
it.
Beckham. Beckham like KC.
Is it possible the vaccine will have to be totally revamped due to its reduced efficacy against Delta and possible other new variants on the way?
Yeah, I don't think there's any talk about that. I mean, what we do know so far is that the vaccines continue to be good, not only because they do create those antibodies, of which we have seen the neutralization activity of those antibodies decrease, and I think that's probably what this question is referring to. But the saving grace of these vaccines is that you still have those conserved areas on the spike protein to which your T cells react to. So that has helped to keep the efficacy. And again, what are we talking about? We talk about efficacy. It's that ability to stop people from going to the hospital, getting severe disease, going to the ICU, getting on the ventilator, and dying. So that is the main goal of these vaccines and the main efficacy there. And we still do see that. And we have seen that with all of the variants so far.
And vaccine efficacy is reduced, but it's still really good against the Delta virus with the vaccination. Remember, we have 98% of our deaths since the Delta virus came on our scene have been in unvaccinated populations, and the 4 people who have died after the vaccination from the Delta variant are all so chronically ill that I swear to you, a raindrop could have tipped them over. And I think that's the problem, and you have to be careful with the data. Have we lost young, healthy people who've been vaccinated from the Delta variant? No. Have we lost unvaccinated young, healthy people? Absolutely, and we continue to do that. Our average age has dropped from like 58, almost 60 years down to about 52 or 53, and it's because we have so many unvaccinated patients in the hospital. The other thing to remember about the vaccination is this: how many nursing home patients are coming into the hospital with Delta right now? And the answer is very, very, very few. And the reason is because vaccination works.
What kind of treatments or meds are being offered to help beat COVID, particularly Delta?
Yeah, right now there's no change in the treatment algorithm that we've had almost since July of last year when we really finalized that. That continues to be on an outpatient basis. If you meet criteria, it's those monoclonal antibodies. Luckily, we still have some of the monoclonal antibody cocktails that still are active against Delta variant and the other variants that we've seen recently. So those are for people that now there's a new authorization for post-exposure prophylaxis for people. So if they've been exposed to somebody that they know has COVID and they are high risk, they are able to meet criteria to get monoclonal antibodies. The other one is if you are have some symptoms, but you are high risk of going to the hospital, you can get monoclonal antibodies as a means to protect you from progression of disease and going to the hospital. So that's just for outpatients right now. The other thing for inpatients, really, again, our treatment algorithm has been the same since about probably June or July of last year. And that consists of remdesivir, which is the antiviral drug, which, again, it's better to treat early on in disease. If your disease or symptoms started 7 days or less or 10 days or less, it's much better to get that drug then. Again, the blood thinners, anticoagulation is important, and then if you meet criteria, it will be the dexamethasone, the steroid, and then there are some other immunomodulators that we use too if you have severe disease. So those treatment plans have not changed at all. We still use those. Those seem to be our best bet. Now, we do know other drugs are in the pipeline and people are looking at using other drugs for COVID-19, but as of yet, those are the only things that are really recommended.
And two quick comments. First, New England Journal of Medicine this week had in one of their large studies looking at anticoagulation in COVID-19, showing that it clearly does have a benefit if you have moderate to severe disease. Maybe not as much if you have mild disease, which, okay, fine. But if you have moderate to severe and you're hospitalized, you need oxygen, you're going to the ICU, you need to be on anticoagulation. Second thing, just a personal story. One of my patients recently, she's immunosuppressed, and she doesn't do well with T cell immunity, and as a result, she has a lot of chronic infections. And so she got COVID-19. She's vaccinated, but she is the category of patient you think, God, did she really get a very good vaccine response? And especially, I bet in another month or two, we're going to be giving people like that a third vaccine. But at any rate, she had two. She then got COVID-19. And now we gave her monoclonal antibodies, and man, she got so much better. So I think this monoclonal antibody thing doesn't get enough play. If you're sick and you're at risk, you should be getting monoclonal antibodies. And I think if you have questions about that, we have a whole screening process. Most places, most other major hospitals do too. So I think that's something for folks to consider.
Yeah, and we should mention our own Dr. Louis Satterwhite of critical care and pulmonary medicine is one of the authors on that anticoagulation study from New England Journal of Medicine.
Well done, Louis.
So.
Okay, I've had two.
He's been on the program a few times.
I've had two non-COVID related viruses this summer that lasted about 2 weeks. I hardly ever get sick. Could the vaccine be playing a part in immune responses to other viruses? No, that's not what happened. I expect that when masks came off, people went out and partied. And, so masks change your behavior in so many funny ways, right? There's not just the fact you have a mask on, but suddenly you get a mask on and you think, am I really going to go outside? Or what? I think people change their behaviors in a lot of ways when they have a mask on. Sure.
Then you take the mask off and you're like, freedom. And then you change your behaviors again. And it's not just that you took your mask off, but you want to go out and party. And suddenly people are closer together again and everything changes. It's not just a simple mask on, mask off. It's also what your other behaviors have changed. And so I think we are seeing an uptick in parainfluenza and RSV in the community, starting to level out now, but I think people took their masks off. There were still viruses out there. We still got sick. The conclusion that people want to draw is that, well, if I hadn't been vaccinated, hadn't been wearing a mask, we would not have had an RSV and parainfluenza outbreak. Really? And how do you know that? Because we have had summers with parainfluenza and RSV before. Now, normally they're more fall-borne, but they can be summer-borne. And so I think I'd be very careful assuming that everything that happens in your world is due to vaccination.
Well, yeah, because these behaviors changed around the time we got the vaccine.
Everything changes, and diseases happen all the time. I got cancer because I got vaccines. Really? There was no cancer before vaccination? No, that's just not true.
Yeah, well said.
All right, how accurate are home testing
I'm on a
kits?
rant.
That's all right. Go. It's Friday. You got to get it out.
It's my
before the
Friday
weekend.
rant. Watch out, people.
Go for it.
Here it comes.
So these home testing kits, are they accurate?
I think that's debatable. I think you have to consider a lot of things. Number one, is the technology accurate and pretty good technology? I would think so, yes. But I think you have to consider where are you at in that disease process? Are you just doing it after, say, maybe you got exposed? Are you doing it because you have symptoms? And then the other thing Dr. Stites mentioned, I think yesterday, was just talking about user or operator error and the ability of yourself doing that test. So I think there are a lot of variables in that.
Where do these come from? Are they sent to you? Do you buy them somewhere?
I believe you can, I believe some of them are sent to you.
Okay.
Some of them you pick up, but then again, you have to send that result off sometimes. I don't know that they have home
I think there's a home
result
testing
ones
kit
yet.
I thought there was.
The Binax now. I just don't know if you can get that result at home or you still have to send it off.
I would
if it's
definitely not
positive,
trust myself.
I think if it's positive, it's positive. I think if it's negative, you have no idea if you're
negative. I would be questioning it from there on out.
Then you gotta go get a PCR.
I think if you're having symptoms and you're positive, I think that's a pretty good result that you can trust. If you are having symptoms and you're negative, I think you should probably still follow up with a confirmatory PCR.
A backup. All right. So how long until herd immunity do you think with positive antibodies and now with the vaccine available? herd immunity?
Oh,
Is this
I
happening?
don't know. Listen, we're saying 80 to 85% of people need to be vaccinated before we can really think we have good immunity and we can get rid of the Delta variant. And by the way, vaccines are up across the United States right now, so that is really, really, really good news. We just had the most people vaccinated than we've had in over a month, so that's great. But it's still not anywhere near fast enough. So here's the deal. I think the problem is that we're not sure that infection with the alpha or the original strain really protects you that well from the Delta variant. And so is that going to help us achieve herd immunity? I don't know that I'd have a lot of confidence in that. The second thing is that if people don't get vaccinated, then eventually the original immunity, if you had COVID over a year ago, I'm not sure you can get it counted in the herd immunity anymore, because I'm not sure how much immunity you have. Now, there's some information out there that says you still can retain the memory B cells and T cells for a long, long time.
Yeah.
But we don't know if that's going to make herd immunity or not, because you could still be passing the disease around.
Yeah, we don't know where it correlates with your immunity and your ability to fight off disease, and again, also not spread it, which is important as well. So, I think looking at that number, we would have hoped by the number of cases so far, recent cases, plus also vaccination, we may have reached that threshold or close to that threshold of herd immunity, but obviously we aren't seeing that here.
Mm-mm.
So I think, I think it's still difficult to say, and I think more to your point that you had just talked about as well is probably.
But you can get closer to normal. You can get what people really want. Everyone wants to have herd immunity, have the coronavirus go away. It's not going to go away. Not for hopefully it will, and hopefully I'm completely wrong. But I would say instead, let's figure it's around for a long time, 5 or 10 years. That's it. And people say, "Oh my God, that's terrible news. I can't take it anymore." No, what you can't take, what you don't like, is the changes in life. Right? I have to be worried about who I'm around. I have to wear a mask, etc. Okay. There's a difference between getting rid of coronavirus and being more normal. Mm-hmm. We're not going to be absolutely whatever normal was for a very long time if we're ever there. But we can be a whole lot more normal. We can get a whole lot better than we are. Mm-hmm. We really don't have to wear masks forever, but there's one way to do it.
Yeah.
Get vaccinated,
Vaccinate.
right? Live long, prosper, V for vaccination. There we go.
There it is. Okay, I'm fully vaccinated, had vertigo 2 to 3 days, but no other symptoms. My unvaccinated 10-year-old niece is coming to visit. Should I get tested before she arrives just to be safe?
Well, I'm guessing, that this question means that person, that was a symptom that they had. I don't know how long ago it was. That's not, I would expect more symptoms rather than just vertigo. I'm not really aware of that as a common symptom in this disease from the beginning of the pandemic till now. I don't think that's a very common symptom. If you're fully vaccinated, depending on how long ago that symptom was, if it was more than 10 days, you're probably okay. If you still want to be sure and you're concerned, you can always go get testing. Testing is accessible now, whether it's, you can even try the antigen test if you want. We know some places offer those rapid results, or go get PCR testing. But to me, that doesn't sound like a consistent symptom of COVID-19. But again, we've also seen with COVID-19, you just never know. So.
Should I hold off on starting my young kids in soccer? How much increased risk are they at? I actually believe one of my young kids had COVID, is now experiencing long hauler symptoms. What should I do?
Yeah, that's a great question. First of all, let's take on the long haul symptom in children. It can occur, by the way, so that could be true. But I would visit with your primary care physician for your child and see what their recommendations are and what can happen. Most long haul symptoms do tend to dissipate over a period of time. I was looking at some data today. We've treated over 343 unique folks here at KU with long haul symptoms, and actually they've seen a total of about 30 different types of providers are involved in that clinic, because it can be such a far-ranging symptom. But I would talk to your primary care physician and see. The question about soccer is also a good question, and I think that's just one of those risk things you have to weigh. Are your kids going to be mass playing soccer? I'm going to say probably not. Are they vaccinated? Probably not at 10. So is there a risk they're going to spread the Delta variant? Yeah, there is. Mm-hmm. How healthy are people at your home? Is everybody at your home vaccinated? Do you think they can handle this illness? And if the answer to those questions are, we feel safe at home and everybody's really pretty healthy, we've all been vaccinated, and your child's pretty healthy, I can probably play soccer. But it's all going to come down to your risk ratio, I think, Hawk.
Yeah, I think that's exactly it. And we're going to be seeing this, and you kind of alluded that even with the Garth Brooks question. It's going to boil down to now individual risk assessment and tolerability of risk. We do know the benefits of activity and exercise for children and socialization doing those things. So I think that's important to consider. But you have to consider those other details about who else is in the household, who else are you interacting with, who may be more vulnerable to disease. But I think overall, doing that activity in just that plain question without consideration of those other issues I mentioned, overall, playing these activities, doing these things outdoors is going to be much safer.
Okay, we've got 5 minutes left. I want to get a couple more questions in. My father insists he knows people who have died of the vaccine, but also knows people who have died of COVID. He says his unvaccinated physician told him not to get the shot since he has a high blood pressure. We really have a hard time believing this. Help. Yeah. Do you have a short answer to convince him otherwise?
My short answer is to get the vaccine. Millions, billions of doses have been given across the world, people. That's approximately a very large number. And people are not dying in droves from the vaccination. Have there been a few deaths? Yeah. The central venous thrombosis, real attributed to the AstraZeneca and maybe the J&J. Vanishingly small. However, it can be treated, and now that we know how to do it, we're handling it very well. Mm-hmm. The FDA is looking at all that data right now. They've not revoked anybody's early use authorization yet. So the idea that vaccination is as deadly as COVID is just false. It is just false. And so I have not yet met a patient who is dying from COVID-19, who is unvaccinated, who said, man, I'm glad I didn't get the vaccine.
Yeah.
How about you, Hawk?
No.
What about taking advice from an unvaccinated physician?
Yeah, I don't know why that person's choosing to not be vaccinated. Yeah. Vaccine's not going to. It's like saying influenza vaccine, don't get it because it exacerbates your high blood pressure. Also false. The COVID vaccine does. We've done over 100,000 vaccinations here. There are nearly that many here in our hospital in our health system. Hypertension or an exacerbation of high blood pressure is just not a side effect we're seeing. We're just not seeing it. I just don't think it's true.
All right, I'm going to stop us. I'm going to hang on to some of these questions that are coming in from our community, and the guys are really happy. I usually go over. I ignore all time cues. I'm kind of like you.
Okay, me too. But the argument is
I know. It's like I said I'm going to stop there. They're like, yes, you're going to stop talking. Okay, so let's do some final thoughts. Dr. Hawkinson.
Yeah, everybody continue to be safe. We know it will be nice weather. Do things outdoors this weekend. If you do happen to go to the Garth Brooks concert, which it sounds like he made a very thoughtful comment about that, continue to protect yourself. First of all, please go get vaccinated this weekend if you haven't already. And if you are in those situations where you do feel uncomfortable, you can always wear a mask and distance as much as possible, and that will provide more protection to you. And I think, again, as we go on through this pandemic, through these next few weeks and beyond, it will continue to be an individualized issue where you have to understand what risks you're taking and what risks you are able to tolerate to keep yourself and your family safe.
Dr. Stites, before I get to your final thoughts, how are you liking your new chair? This
is the best. Have you guys noticed it doesn't squeak? They used to give me the squeaky chair so I'd stop rocking. And because I'm older, I needed a rocking chair. They took away my rocker and they took away the squeak. So I get
But we also took away your armrest.
Now I'm doing this like this.
Now you can't sit back and relax.
I can do this. I am the producer's nightmare. I'm never on script. I can't sit still.
You're our favorite nightmare.
I squirm all around. Hey, this is what I got to say to folks. Listen. We try so hard to be earnest, and we know that the questions you ask are in earnest. And here's another earnest answer. We want to see you tomorrow and the day after that, and we want to hear your earnest questions. And there's one way to keep being earnest, and that is to also be honest. We've said to you before, we're building the airplane while we fly it, and we got a lot better plane now than we had when we started this crisis. I'm not telling you that it's perfect. I'm not telling you that it's the fastest jet, but we got a lot more stuff that we know on this plane than we did. And here's what we know. Masking is simple, it's safe, and it works. Vaccination is safe, and it works. And we want you to be here tomorrow to keep us earnest. So take care of yourself. And remember, Jess, there's still no place like home.
There isn't. All right. Thanks so much, guys. We appreciate you as always. We appreciate all of you being with us today. We are back on Monday to talk about the spike in RSV cases. And of course, we're going to talk COVID. We'll take your COVID questions as kids hit the classroom next week. A lot of questions. Be safe this weekend. Have a great one. We'll see you here on Monday.